Hi, I'm Katy Ashe, and I'm one of the co-founders of Noora Health. And we train marginalized patient families to take care of a loved one, to improve outcomes, and save lives. These are pictures from a government hospital in Tumkur, India. And as you can see, it's extremely chaotic. Families crowd the hallways, they crowd the waiting rooms, because whenever a patient comes into a hospital, they're accompanied by several family members that travel with them from their village and stay with them days, sometimes weeks, while their patient is treated. They're not allowed to interact at all in the health system. They're sometimes allowed to come into the hospital for 30 minutes a day for visiting hours. So basically, they spend weeks anxiously waiting. On the other hand, you have a health system that is incredibly overburdened. Doctors in a lot of the facilities that we work in are treating hundreds of patients a day. And a lot of people see this crowding and they say, this is a symptom of the problem. And it's true. It's very chaotic. But we think that this is part of the solution. Because on the other side of the wall is Anup. Anup here is 2 days out of open heart surgery, and he spends the vast majority of his time alone, being served by a nurse that's taking care of 30 patients at the same time. Then, about a week later, when it's time for Anup to go back to his rural village, a nurse will call in his parents and give them a 5-minute shotgun lecture about everything that they need to know in order to keep Anup healthy and safe when they return home. And his parents return home terrified because they are unprepared. We think that this is one of the largest missed opportunities in health. On one hand, you've got a wildly overburdened system and patients that aren't getting enough attention. And on the other hand, you have a highly compassionate, motivated resource in the family members. That's why we take those waiting rooms and hallways and we turn them into classrooms. And we use a train-the-trainer approach to turn nurses into the teachers. In our classrooms, families are taught using interactive Bollywood-style health drama videos. They're given charts that are basically the equivalent of an IKEA diagram for your health condition that they then take home with them. Family members are allowed to perform these health tasks under the supervision of doctors and nurses, and by the time that they go home, they're certified in the condition that their patient has. The impact of this reaches far beyond the hospital walls. This is Aditi. We trained her in a hospital in Kolkata. She returned back to her home. This is us on a home visit with her entire family. She had trained no less than 15 people in her local community on how to help her take care of her husband, how to prevent heart disease, and how to react to emergencies. And this is really working. A recent study conducted by Stanford researchers shows that we reduce anxiety in caregivers by 6 times. We increase patient satisfaction by 40%, but most excitingly, we reduce post-surgical complications by 71%. This is so exciting because it's the strongest predictor of mortality. So we have this highly impactful, scalable intervention, and we're taking a 3-phase approach to making sure that we can help bring it to the world. In phase 1, so in the last little over 2 years of being an organization, we've brought this to 35 major hospitals. We've trained 55,000 families, and we're entering phase 2. We already have 90 hospitals on a wait list, and we plan to, by the end of 2018, be in over 200 hospitals, having trained over 1 million patient families. And excitingly, the tipping point for us is that we will have reached sustainability in India, because we cross-subsidize between working with large private chains and public district hospitals. So by the end of 2018, we will operationally be break-even in India, meaning that future resources can go towards replication in other markets. These pins represent current health systems that are asking us to come and provide this for them. In order to complete phase 2 and reach sustainability in India, we need $2.4 million. We've raised 1.8, so we're looking for a further $600,000 to achieve that goal. Our goal is to make sure that this becomes an intervention that becomes part of the global standard of care. We think that every family, like Anups, should have this. Thank you.